Physiotherapy department at Pride Veterinary Centre has access to both an underwater treadmill and a hydrotherapy pool. Having both allows us to be unbiased in selecting which form of hydrotherapy treatment is best for the individual case. Here are a few short videos showing when and why we would use an underwater treadmill. Riley was referred to physiotherapy for chronic stifle pain following post-operative complications for a TTA on his stifle. Riley presented at physio with poor muscle mass, pain, decreased range of motion and poor gait pattern. The treadmill is a brilliant tool for neuromuscular rehabilitation for both neurological and orthopaedic conditions. We use the buoyancy of the treadmill to reduce the weight-bearing load on the joints affected. By having the water up to hip height, we can reduce the body weight by up to 62%. This is brilliant for post-operative patients, patients that are in pain, and patients that we need to lose weight, so need to take some strain off their legs. The treadmill is brilliant for retraining gait in our neurological patients. Having the water to a certain depth helps the patient's balance, and the feeling of the water around the legs increases both the sensory and proprioceptive feedback. Riley came to physiotherapy initially weekly for the first 8 weeks. This consisted of work on the treadmill and a home exercise plan and a gradual increase in walking exercise. After the 8 weeks of weekly, Riley dropped down to fortnightly physio and is soon going to be dropping to monthly. Murphy at 60 kilos is one of our biggest clients. Whilst he doesn't have any orthopaedic problems at the moment, large breeds of dogs are particularly susceptible to hip and lower back problems. Murphy's owners have brought him into physiotherapy to help build up and develop a much stronger muscle mass to support his hind end before he starts reaching his older years. Tasha is one of our smaller physiotherapy clients. She's been coming to Pride for 6 months following referral from one of the vets after she'd started to become more stiff in her hind legs. Tasha, 10 years ago, had surgery for cruciate ligament injuries to both hind legs, and several years down the line has developed arthritis. We use a combination of low-level laser therapy and work on the treadmill to improve Tasha's range of motion and muscle mass. She now only needs to come to physiotherapy once a month just to help maintain the range of motion that she's got.